A warning for parents tonight of young children especially about a respiratory virus that's on the rise. Doctors say it can be as dangerous as the flu if it lingers too long. It's something you need to know about. It is called Respiratory Syncytial Virus, or RSV. Hospital officials at Cook Children's in Fort Worth say that they're seeing a drastic spike in cases. Ken Molestina spoke to a pediatrician to explain what to look out for with the little ones. Ken?
Yeah, Doug, you know, the reason this is so worrisome, even for doctors, is because it doesn't take much for RSV to develop into something a lot more serious like pneumonia, and unfortunately that's happened to way too many families recently.
So RSV is a virus that causes respiratory illnesses in children, most notably like the infants.
Dr. Ramon Kinlock is a Cook Children's pediatrician. Hospital officials say just within the last week, beginning on November 18th, they've treated 178 cases of RSV. 90% of those infants ended up in their emergency room.
RSV is something to be taken very seriously.
And the symptoms, he says, usually start off looking like a cold.
Nasal secretions, the congestion, and just the bad cough, sometimes a fever.
But if it's left untreated and an infant's body fails to fight off the virus within a few days, Dr. Kinlock says their condition will degrade quickly.
They can develop worsening respiratory symptoms that can lead to pneumonias or respiratory failure, and those are the ones who would need hospital visits.
Dr. Kinlock suggests clearing a baby's nose if they're stuffed up at home or using a humidifier if they have a cough. He also says the best way to cut the risk of RSV exposure is one we've all heard before.
So hand washing is going to be the #1 way to minimize the spread and prevent the spread of that.
Should your child come down with signs of the virus and their condition doesn't improve, Dr. Kinlock says don't hesitate in seeing a doctor.
If you're worried about those symptoms worsening and there's more that you need to do, certainly check with your doctor.
Well, Dr. Kinlock also advises parents to keep a very close eye on daycares and other children who could be the source of a possible RSV outbreak. Doug?
Good information, Ken. Thanks.